Please be seated. Good morning. It's my pleasure to present to you Howard J. Fedoroff, MD, PhD, the Executive Vice President of Health Sciences and the Executive Dean of the School of Medicine. Dr. Fedoroff.
Honored guests, graduating seniors, parents, spouses, and friends, welcome to the graduation of Georgetown University and the 163rd commencement of the School of Medicine. Thank you to our color guard, all of whom are medical students representing Army, Navy, and Air Force. Sarah Fogelman, Rita Snyder, and Sarah Davis. A special thanks to the following graduates in the senior choir for singing the national anthem: Sheila Putseyets, Stephanie Van. Dr. Princy Kumar, MD, Professor of Medicine and Microbiology and Chief of the Division of Infectious Disease and Senior Associate Dean for Students, has been selected by the students to give the invocation. Please rise, Dr. Kumar.
God of all blessings, shine your light and send your Spirit upon us as we gather to celebrate the graduation of these daughters and sons of Georgetown. Bless these talented women and men whose intellectual curiosity and desire to serve the sick brought them here to us just 4 years ago. They came to explore with reverence and wonder the depths of your good creation and to become healers of those in need. As you have blessed them with abundant knowledge, bestow upon them now your guiding wisdom, such that their knowledge and their skills will bring healing and comfort to all whom they touch. Bless their parents and teachers who have guided them, and all those who have labored to instruct and challenge them along the way. Bless the sick and needy, whose lives will be touched and whose burdens will be lightened by the knowledge and compassion of these dedicated young physicians. May they always feel your presence in their lives, especially when their work days are long and their nights are filled with doubt as to whether they have given their very best. We ask all of these things in your most holy name. Amen.
Please be seated. Although the university's founding date is 1789, it was 200 years ago, on March 1st, 1815, that the President of the United States, James Madison, approved the federal charter for the College of Georgetown within the District of Columbia. Introduced into Congress by our first student, William Gaston, this spring, on March 1st, 2015, the President of the United States, Barack Obama, sent greetings to Georgetown on the occasion of the bicentennial of that charter. Among other things, he said, and I quote, "Simply put, this country and the world benefit from your commitment to Jesuit principles, to being men and women for others. It is our venerable custom to begin academic ceremonies with a reading of the charter. To discharge that office, I have the honor to present Mr. Edwin M. Quinn, Secretary of the University. Mr. Quinn.
An act concerning the College of Georgetown in the District of Columbia.
Be it enacted by the Senate and House of Representatives of the United States of America in Congress assembled, that it shall and may be lawful for such persons as now are, or from time to time may be, the President and Directors of the College of Georgetown within the District of Columbia, to admit any of the students belonging to said college or other persons meriting academical honors to any degree in the faculties, arts, sciences, and liberal professions to which persons are usually admitted in other colleges and universities of the United States, and to issue in an appropriate form the diplomas or certificates which may be requisite to testify to the admission of such degree. Signed, Langdon Shivas, Speaker of the House of Representatives, John Gaillard, President pro tempore of the Senate. Approved March 1st, 1815, James Madison.
I would like to call to center stage our honorary degree recipient, Richard Gilfillan, MD, MBA, President and Chief Executive Officer of Trinity Health. Today, Georgetown University recognizes Dr. Richard J. Gilfillan, a preeminent leader in healthcare policy development and who has contributed many innovative solutions for improving the nation's healthcare system. He successfully navigated through the turbulent era of healthcare reform and provided exemplary leadership to the three key perspectives of government, payer, and provider. Gilfillan earned his medical and his undergraduate degrees at Georgetown University and started his career as a family physician at the Georgetown University Community Health Plan. He later moved to Massachusetts, where he helped to found a community health center and a family medicine practice. His first position in the insurance industry was as medical director for Medigroup, Central, and HMO, a Blue Cross of New Jersey managed care plan. He served as Senior Vice President for National Network Management at Coventry Healthcare and also held positions at Independence Blue Cross. Gilfillan later became the Chief Operating Officer of Geisinger Health Plan and Executive Vice President of Insurance Operations for the Geisinger Health System. The mission and values of Georgetown University shaped his perspective and have guided his career. Gilfillan was thinking about value-based models when he was in medical school at Georgetown University in the 1970s, examining HMOs and the tripartite goal of better patient experiences, improved population health, and reduce costs. I quote, Dr. Gilfillan said, "I went into healthcare because I was always interested in figuring out how to get great healthcare to people." He was tapped by then Administrator of the Centers for Medicare and Medicaid Services, the CMS, Don Berwick, MD, to help chart a successful path for the Affordable Care Act. Gilfillan, true to his Catholic and Jesuit education, put patients at the center of all deliberations. As the CMS Innovation Center's first leader, Gilfillan was instrumental in establishing new payment and delivery models such as Medicare Accountable Care Organizations and bundled payments. He set the tone for new programs that coordinate care for enrolled populations seeking to reduce costs while improving patient outcomes and satisfaction. He was driven by a vision he calls True North, an alignment of all parts and players in the healthcare system away from rewarding volume towards rewarding value. This is in order to produce affordable, quality care. After 3 years as leader of the Innovation Center, Gilfillan shifted to the provider side, taking the chief executive position in October 2014 at the newly merged CHE Trinity Health. The merger brought together more than 80 hospitals from the former Catholic Health East and the former Trinity Health. In recognition of his distinguished career in healthcare and his service to society, and for his leadership and innovative efforts on behalf of patients, Georgetown University awards Richard J. Gilfillan, MD, the Doctor of Science, honoris causa. President DeGioia will now officially confer the honorary degree.
By virtue of the authority vested in me by the Congress of the United States and by the Board of Directors of Georgetown University, I hereby confer the degree of Doctor of Science honoris causa on Richard J. Gilfillan. Ladies and gentlemen, it's now my pleasure to present to you Dr. Richard Gilfillan, who will deliver the commencement address.
Thank you so much, Dr. Fedorov, for that introduction, Dr. DeGioia, Dr. Mitchell, for the opportunity to be with you all today. It's really quite an honor, not one I ever expected to receive. Thank you all for that warm welcome. It's great to be back at Georgetown, and I'm honored and humbled to be part of this ceremony. Parents, grandparents, family, friends, deans, and faculty, thank you all for supporting these young women and men on their long journey. You helped them get here, and now they've become your gifts to the world. Let's all give these very important people a great hand. As the parent of four wonderful children who went to college and graduated, I know how special a day this is for you parents. So enjoy it, and congratulations, and thank you for a job well done. So in the spirit of a Jesuit university, I feel compelled to confess something today. So I'm going to admit that, yes, I was part of a crew that painted the John Carroll statue as Santa Claus for Christmas 1967. It was beautiful. We used water-based paint, but it was short-lived. The police rapidly dispersed us, chased us. I served my penance that night, sleeping next to the dumpster behind Weissmuller's. I'll take that for forgiveness. Thank you. But I'm proud to be here today as part of American Catholic Healthcare. It's a ministry started by small groups of religious women and men more than 160 years ago. Many came from Europe in small numbers. They had minimal resources and no healthcare training. They became nurses, teachers, and administrators. Some rode horses to remote mining camps out west. Others served on Civil War hospital ships. These founders were called to care for people however, wherever, and whenever they needed it. Catholic healthcare, Georgetown included, now provides 16% of all hospital care in America. Today, I'd like to talk with you about how we can continue this remarkable legacy of bringing healthcare to as many people as possible. Before I do, let me express my thanks for the excellent undergraduate and medical school education I received here at Georgetown. But my greatest debt of gratitude to Georgetown is because they had the wisdom to accept Carmen Canita, my wife, friend, and partner of 47 years, into the class of 1971. I'm certain that were it not for meeting Carmen at Georgetown, I would not be standing here today. Acceptance into medical school was for me, and probably will be for you, one of the most fortunate occurrences of your life, aside from meeting your life partner. As a family physician, I experienced the deep personal satisfaction derived from serving thousands of individuals and families when they needed it most, along with the sadness at times when all I could do wasn't enough, or for some reason, I didn't rise up and give a patient my best. Every job I've had provided opportunities to positively impact people's lives, for one patient at a time in practice, and sometimes for millions in doing policy work. Each was deeply rewarding in its own way, and in all, I was guided by the commitment to always do the right thing for patients that I learned right here at Georgetown. From my experience, I'd say you've made a very wise choice. It's a real privilege and honor to become a physician, and I was very fortunate to be admitted to medical school. All of us, of course, worked very hard to reach this point, and while I know you come from many varied backgrounds, I suspect that most of you have also been fortunate in important ways. After all, we're all products of the gifts we're born with, the efforts we make along the way, and the good fortune we experience. There are others, of course, who work equally hard, but are not so fortunate. That's why a social safety net is a critical part of a just society. And I learned that at Georgetown. As our last 4 generations of Americans worked hard to build the most advanced economy in the world, they also systematically extended our safety net. My parents' generation gave us Social Security. Our parents created Medicare and Medicaid to ensure that the seniors and the poor had access to health care. But these improvements still left many Americans without coverage. In 1994, we baby boomers took our shot at universal health coverage, and we did not get it done. By 2008, 48 million Americans were uninsured, twice as many as in the 70s. That year, led by our children's generation, and including you millennials in record numbers, we did get it done. We elected a president and a Congress that, through the Affordable Care Act, created the potential to close this gap in our safety net. But that was only the beginning of ensuring that all Americans have access to great health care. Expansion is being contested in the Supreme Court. Regardless of the judgment, and I think we'll win, there will be no turning back the clock on expanded access to care. So on now to the next challenge. How can we as a country cover the bill that's coming due, not just for the newly covered, but for all of us? I fly a lot. I have TSA PreCheck. It's great. I walk right through security. Recently, as I approached the medical detector, a very pleasant young man looked me up and down and asked, "Do you have any artificial joints?" I said, "No, they're all original parts. Thanks very much." One thing you can count on, baby boomers will not age cheaply. New hips, new knees, we'll take 2 of everything. Thank you very much. Healthcare with the increasingly bionic baby boomers afoot could consume the majority of the federal budget if we continue to provide care the same way as we do today. Already, we pay twice as much for each person as any other country. Improving the quality and cost of healthcare remains an essential national priority. And aside from demographics, there's 2 reasons we see these high costs. One is that we have an ineffective marketplace and benefit plan structures that insulate us from the cost of services. These issues are being addressed through marketplace reform. But the second major driver of excessive cost is the way we pay providers. Today, we're paid for the services or the fragments of care we deliver, not the outcomes. A hospital admission, an X-ray, a doctor visit generates a payment. An effective transition from hospital to home, or an admission avoided for congestive heart failure because of great care, produces no payment. The explosion in diagnostic and therapeutic technology over the past 30 years has given us many more fragments of care to provide and be paid for. Our delivery system has adapted. We now have SNFists, hospitalists, intensivists, even laborists to care for moms in labor. Deliverers may be right around the corner. You all have many more options than we ever did. We've consciously fragmented care and left the patient and family to fill the gaps, expecting them to integrate and coordinate their own care. It's no wonder that almost 20% of Medicare patients leaving the hospital with an average of 12 different medications are readmitted within 30 days. Despite our best intentions, we do what we're paid to do, and the result is our expensive and fragmented care system. If we want to become a system that provides better outcomes, we'll have to reward providers to deliver it. And the Affordable Care Act did include new models of ACOs and episode payments intended to support coordinated care. Private payers are moving this way as well, and there's growing momentum nationally to make these payment models the norm. Let's assume that we will successfully change our payment systems over the next 3 to 5 years while you all complete your training. You will begin practice then in a system that rewards us for delivering better health, better care, and lower costs for the people you serve. That leaves one big question, actually maybe 2 big questions. Grace, did you really have to kill off McDreamy? You do watch it? All right. One big question. How do we transform our care delivery system, create new care models that produce these outcomes? Across the U.S., there are 18 million healthcare workers, including 3.9 million nurses and 900,000 physicians. They work in 5,000 hospitals and across hundreds of thousands of other locations. They are the ones who have to understand and implement these new care models. Institutional and individual change is very difficult. This is massive change that will ultimately involve and touch every person in the system. And these new care models must be designed to meet all of a patient's needs, not just a symptom or a condition. To accomplish this, we have to understand patients' needs the way patients feel them. I recently recalled an embarrassing medical school lesson about this. My third-year medical rotation was with John Harvey, along with Proctor Harvey, one of the great Georgetown internists of that period. We were gathered around a bed, thoroughly captivated as he interviewed and examined a patient. When he left the room, Dr. Harvey directed us to a nearby room, looked at me, and said, "Rick, lay down on the bed." He put his foot up on the rail of the bed and shook it. And he said, "Imagine you're that patient, Rick. How does that feel?" Apparently, I'd put my foot on the patient's bed, and I didn't even know it. I'm sure the patient did. To design and operate our new system, to really understand our patients' needs, we have to start by putting ourselves in the bed. At Trinity, we frame this change effort as building a people-centered health system. It means we will design and deliver care starting from the patient's needs, not from ours, the providers, as we have so often done in the past. I come to you today with a simple request. Please help us build a people-centered health system. People-centered thinking is not the norm for us in healthcare, at least not yet. At our system, we are now trying to include consumers directly in our planning process. And we also recently created a simple tool. We call it the People-Centered Timeout to help us maintain this focus. You're all aware of the timeout concept from the OR, when the surgeon says, "time out," and the team runs through a pre-op checklist. This tool has significantly improved patient safety and outcomes. Now, in our system, when we're debating priorities, thinking about designing a new lab process, or discussing visiting hours, any member of the team is empowered to call a people-centered timeout. Our discussion starts anew. We take the perspective of a person or family being cared for in our system, and we ask ourselves, how would we choose priorities? How would we design the lab or set visiting hours? We integrate the results of these ideas into our conversation. We think doing this significantly expands our thinking and will lead to better discussions. As you move on to new lives and new institutions, try this out for yourselves. It works at almost any level or any issue. When you're uncertain about how to talk to a patient about a difficult diagnosis, or construct a coverage schedule, take a people-centered timeout, pause, see yourself as the patient in the bed or in a wheelchair and ask, how would I want to hear about my diagnosis? How would I want to be covered over the weekend? Use that reflection to guide your discussion. Now, this may sound like a simple idea. Surely there are more technical things to think about. There are, and we think about them all the time, but technical answers are easy. Changing behavior is hard. We have to systematically work at it. Like the surgical checklist, this could be a very simple but powerful tool to help you be sure your work remains grounded in the needs of the people you serve. Here's an example of what care could look like in a people-centered health system. In Atlanta, there's a small village of shacks next to a swamp that have been constructed by homeless folks. They call it Hut City. At dusk one evening, I was with a mobile care team from Mercy Care, making a home call for a patient or a couple in their late 50s. We were standing under a plastic tarp that served as an awning over a dirt floor patio. A rusted table was circled by 4 mismatched old patio chairs. And behind the patio was a small hut about 6 by 18 feet. An Emory medical student sat at the table, her headlamp shining on the woman's arm as she checked her blood pressure. And the dusk scene was further illuminated by the glow of a laptop PC, wirelessly connected to our electronic medical record and to Grady Hospital a few miles away. The woman expressed concern about her spouse's need for follow-up at one of our clinics. At the end of the visit, we left a bottle of new medication for her and made an appointment for her spouse at our clinic. Care can be very different if we design around the needs of patients, not our own needs. In a few weeks, as interns and residents, you'll be more directly responsible for clinical decisions. I know some of you are wondering, am I ready? What happens if I make a mistake? Remember the sisters in the mining camps and the hospital ships? Many had no training. Imagine their doubts. Recently, a very wise advisor said to me, every leader has doubts and feels like a fraud at times. Surgeons excluded, of course. The reality is that while you have much to learn, you're very well trained. And you're part of a team. On a good team, your colleagues will be there for you, particularly the nurses who are so much more experienced than you will be. So be an effective team member. Be humble, be curious, be bold, laugh a lot, enjoy your work, and celebrate your team. And more than anything else, remember that listening well to your patients is the starting point of great patient care. The transformation of our healthcare system is now possible. We have all the elements to succeed. You're entering a wonderful profession at an extraordinary time. When I graduated from Georgetown Medical School in 1976, we thought we would create a system that would be accessible to all. We tried a lot and learned a lot. The science of healthcare has progressed tremendously, but we did not get that done. You can. You are the first generation of post-ACA physicians. You'll be coming of age in a transformed system poised like never before to provide every American an equal opportunity to reach their potential for a healthy life. I'm confident it will happen. You started it, and you will get it done. Your patients will be better, and America will be stronger as a result. Enjoy this special day with your family. Congratulations to each and every one of you, the Georgetown Medical School class of 2015, on your very special achievement today. Thank you all very much.
Dean Mitchell will present the graduates, assisted by Associate Dean Cameron Jones. President John DeGioia will confer the degrees, assisted by Registrar John Hammett.
President DeGioia, this is a truly remarkable class, and it's fitting that we return here to this historic old theater for the first time since the class graduated here in 1870. This class includes at least 2 members who won NCAA national championships in lacrosse and basketball. They were not Georgetown championships, but numbers of Georgetown's class of 2015 have won intramural championships, and of course, numerous members were members of the championship Powder Puff team, and the Fairfax County champion Ice Dogs, by the way. Over half will go to top 25% programs. They've done thousands of hours of service in inner city DC, hundreds of hours of research with mentors and labs at our institution and others, and they left this city and this school better as a result. We will honor them tonight, this afternoon. We will also acknowledge academic honors, Alpha Omega Alpha, the peer-nominated and elected Gold Humanism Society, and a number of academic-focused tracks. The 163rd medical school class to graduate, this class provides us a good cross-section of the nation. Among 186 graduates today, there are 93 men and 93 women. The youngest is 25 and the most experienced is 37. 34 of the states are represented, led by California, New York, Maryland, Pennsylvania, Massachusetts, and New Jersey. 33 members of the class have a graduate degree. Family members who are serving as special hooders for their graduates should make their way to stage right at this time. Our staff will assist you in getting to the stage at the appropriate time. The graduating class is elected to be hooded by the following members of the faculty: Dr. Princy Kumar, Professor of Medicine, Chief of Infectious Disease, Senior Associate Dean for Students; Rebecca Evangelista, Associate Professor of Surgery and Clerkship Director in the Department of Surgery; Sean Welton, Associate Professor and Clerkship Director in the Department of Medicine; Michael Adams, Professor of Medicine, Vice Chair of Education and Program Director in the Department of Medicine; Mary Furlong, Professor and Director of Medical Education in the Department of Pathology; and Russ Wall, Professor and Chair of the Department of Anesthesia. We'll now ask the graduates to begin to process. Nima Agdam. Imran Iqbal Alarakia. Jacqueline Antonishek. Jennifer Claire Aronica, Alpha Omega Alpha, cum laude. Michael Robert Aukenbaugh. Alexander Belikovsky. Christina Marie Bentz, Alpha Omega Alpha, cum laude. Connor Samuel Benton, Georgetown Gold Humanism Society. Jeffrey Wayen Ben, Gold Humanism, Health Justice Scholar. Lauren W. Bierman. Janine Elaine Boileau. Lindsay Nicole Boyers, Gold Humanism. Heather Elizabeth Boynton, Gold Humanism, Health Justice Scholar. Maria T. Brelanou. Jacob Ross Bronstein. Aaron Nickel Brooks. Haley Ann Bunting. Benjamin H. Capper, Alpha Omega Alpha. Mary Elizabeth Card, Gold Humanism, Health Justice Scholar. Ryan Joseph Carpenter. Matthew Frank Carpinello, Gold Humanism. Charles Mario Casasa IV. Michael Paul Catalino, Gold Humanism. Samantha Skilkin Catlett, cum laude. Thomas Philip Sestar. William Kavanaugh Chapman, Jr., AOA, Gold Humanism, cum laude. David Archibald Cheever, Health Justice Scholar. Duan Chen. Amy Hongfong Chang. Blake Lucas Choplin. Robert Anthony Christian, Gold Humanism. James Clark, Jr. Samuel Frederick Webster Clark. Tabia M. Collins Mitchell. Bryn Shannon Connor, Alpha Omega Alpha. Nicole McRory Constance. Alexandria Julie Coughlin, Gold Humanism. Alexis Lynn Crawley. Mary Catherine Daly. Rebecca Dang. Wally Elias Danish. Catherine Sarah Davidoff, Gold Humanism. Christopher Davies. Aga Khan Puno de Castro. Tensei Demisi. Nicole Channing Devonish. Kelly Catherine DiLorenzo. Virginia Ann Dines, Alpha Omega Alpha, magna cum laude. Catherine Linetsky Duncan, Alpha Omega Alpha, cum laude. Michael Ryan Eby. Suleiman Salahuddin Elamin. Kevin Patrick Emmerich, Alpha Omega Alpha. Victoria Ng. Armand Michael Ismaili. Allison Claire Estep. Daniel Sung-Yoon cum laude. Robert Morton Farney. Islam Faid. Amy Catherine Fairman. Laura Ann Felder, Alpha Omega Alpha, Health Justice Scholar, cum laude. Bess Madeline Fleischner. Julie First. Heather Melville Giannini, Alpha Omega Alpha, Gold Humanism, cum laude. Benjamin Giliberti. Christopher Michael Griney. Valerie Christine Grant. Charles Patrick Hannon, Alpha Omega Alpha, Gold Humanism. Elizabeth Harkin. Heather Marie Hopkins. Byron Douglas Hughes, Health Justice Scholar. George Sobi Ibrahim. Oh, that's cool. Sure. Kelly Beth Akimi Ishihara. Thank you. Sanjay Jalaj. Megan Marie Yanni, Gold Humanism. Da David Jang. Kirti J. Johal. Donovan W. Johnson. Peter Christian Johnson, Alpha Omega Alpha. Nicole Beth Kalinsky. Adnan Karim. Bridget Page Kaufman, Alpha Omega Alpha, magna cum laude. Jeffrey Randall Kampf. Jared Michael Keller. Tyler James Kent. Andrew Charles Carr. Satinderpal Singh Kara. Christine Miran Kim. Elizabeth Migas Kim. Andrew King. Catherine Sarah King. Samuel Harry Clateman. Stephen Daniel Kozusko, cum laude. Rebecca N. Kumar, Gold Humanism. Megan Catherine Cusco. Susie Suyon Kwan. Elizabeth Kathleen Landry, Alpha Omega Alpha, cum laude. Richard Alexander Lane, Health Justice Scholar, Medical Education Research. Lawrence Lester Sing Wing Lau. Diana Catherine Lee. Teresa May Lee, Health Justice Scholar. Derek W. Leon. Sarah Lofton, Alpha Omega Alpha, Gold Humanism, cum laude. Kristen Elizabeth Madison, cum laude. Justine Holly Mann, cum laude. Michael Christopher Mario Renzi, Alpha Omega Alpha, cum laude. Catherine Margaret Maselli, Alpha Omega Alpha, cum laude. Amy Matson, Alpha Omega Alpha, magna cum laude. Christopher J. Maxwell. Michelle Jan Mejia. William Helmsley Merwin III. Kirsten Joan Midgley, Gold Humanism. Kevin James Philip Meisner, cum laude. Adam J. Money. Patrick William Daniel Moody, Alpha Omega Alpha, cum laude. Matthew John Moynihan. Priya Mukherjee. Megan Murphy. Joseph Christopher Murray, Doctor of Medicine, Doctor of Philosophy. Nikhil Krishna Murthy. Ryan Daniel Navarro, Alpha Omega Alpha, Gold Humanism, magna cum laude. Samantha Cass Newman. Peter Nguyen. Alexis K. Nichols. John Edward Nolan III, Alpha Omega Alpha, summa cum laude, Gold Humanism. Nodra Bazurgi Nuri. Mark Stephen Norton, Alpha Omega Alpha, cum laude, Gold Humanism. Mutsa Nayakabao, Doctor of Medicine, Masters of Public Health. Health Justice Scholar. Peter Edward O'Halloran. Jessica Lynn Panks. Tarina Claire Parpia, Alpha Omega Alpha, cum laude. Heather Pemberton, Alpha Omega Alpha, magna cum laude. Ashley Colleen Pfaff. Ashley Lawana Perosi. Emily Nicole Platts, Gold Humanism, Health Justice Scholar. Sheila Murray Posadas. Catherine Walsh Prather. Megan Lear Pryor, Gold Humanism, Health Justice Scholar. Joseph Raby. Joseph James Ravis III. Allison Laurel Raybold, Alpha Omega Alpha, Gold Humanism, cum laude. Mark J.R. Ginto Reel, Gold Humanism. Mary Jane McMahon Reen. Julia M. Riley, Medical Education Research, Gold Humanism. Alice Hojung Ri, Health Justice Scholar. Derek Knight Rogalski, magna cum laude, Alpha Omega Alpha, Health Justice Scholar. Matthew Kevin Rosen, Alpha Omega Alpha. Aaron Jason Rubenstein. Mark Edward Rousseau, cum laude. Catherine Wagner Sanchez Maldonado. Maximilian Albert Schellinger. Jonathan Ira Siegel, Alpha Omega Alpha, cum laude. Joanna Lee Schechtel. Jaskaran Singh. Titiloa Tamatopa Shode. Christopher Sane. Andrew David Staffaroni, Alpha Omega Alpha, cum laude. Kamil Stefanowski. Weston Scott Stover. Melissa Ann Straub. Kara Ann Sweeney. Stephen Thomas Swinford, cum laude. Alexander X. Ty, cum laude. Catherine Ann Teixeira, Alpha Omega Alpha. Claire Elizabeth Thiesing, Gold Humanism. Christopher Andrew Thomas, Gold Humanism. Liam Thon Tran. Anne Tretton. Elizabeth Carol Truelove. Anli Kayan Sang. Julia Say, Gold Humanism, Health Justice Scholar. Meryl Megumi Ueno. Catherine Marie Unverfurth, Alpha Omega Alpha. Ivan Uritz. Stephanie Pham Van. Kurt Wagner. Sandeep Singh Walia. Mitchell Harrison Wexler. Graham Wolf. Daniel Stanley Wong. Jennifer Eileen Wu. Kurt Andrew Yeager. Sojen Yoon. Janice Helen Yoon. Habib George Zalzal. Will the class please stand for the conferring of degrees? This makes it legal. President DeJoy, as Dean for Medical Education at the Georgetown University School of Medicine, I have the honor to present you these candidates for the degree Doctor of Medicine and Doctor of Philosophy. They have been duly examined and recommended by the faculty. I therefore ask that you bestow on these students the degree Doctor of Medicine. I also ask that you bestow on our dual degree student the Doctor of Philosophy degree.
By virtue of the authority vested in me by the Congress of the United States and by the Board of Directors of Georgetown University, I officially confer upon these candidates the degree of Doctor of Medicine, and to the one MD, PhD student, I also grant the Doctor of Philosophy.
Go, Joe.
Donald Noland, MD, Professor Emeritus of Medicine and Cardiology, will administer the oath of Hippocrates. Dr. Noland.
Thank you. Thank you, Dr. Farrell. We want to invite all the physicians in our audience today to join with our graduates in reciting the oath. Please stand. Wait a minute. Repeat after me. Use your own name, of course. I, Donald M. Noland, solemnly promise to God Almighty that according to my ability and judgment, I will endeavor at all times to observe the stipulations of this oath, which through ageless tradition has governed the conduct of my predecessors and the profession which I am about to enter. Appreciating the benefits of the instruction accorded to me, I promise to esteem and revere the teachers who have trained me in the science and art of medicine, to share my good fortune with them, and to relieve their necessities should want befall them. To all who are deserving, but to none who are unworthy, I will freely impart a knowledge of my science and art. I will adhere to the doctrine and prescribe the treatment which my ability and judgment assure me are most beneficial for my patients. I will abstain from everything which may be harmful or dangerous to them. I will attempt no treatment which evidently requires training and skills superior to mine. Hang in there. With purity of purpose and holiness of life, I will practice my profession. My every word and deed in the homes of my patients or in other places of treatment will be directed solely to the welfare of these patients. With the help of God's grace, they will find no occasion in my speech and actions to disrespect my profession. Whatever I see or hear as I practice my profession, which should not be revealed, I will not divulge because such knowledge must remain secret. As long as I keep this promise, I hope to enjoy happiness in life, success in my profession, and the respect of my fellow men and women. But may the reverse be my lot. If I should willfully violate my solemn word now given before God. Welcome. Thank you.
President DeGioia will now make final remarks.
Please be seated. Well, thank you, Dr. Fedorov. This is Dr. Fedorov's last commencement season with our community as he moves on to the next step in his extraordinary career. I'd like to express on behalf of all of us our appreciation to Howard Fedorov for his contributions and leadership throughout these past 8 years at Georgetown as he has led Georgetown University Medical Center and to wish him well in the next steps in his career. Howard. And on behalf of all of us, I wish to express our gratitude to Dr. Richard Gilfillan for making this very special day that much more special by sharing with us the perspective and insight gained throughout his life's work. Dr. Gilfillan, thank you. It is a great pleasure and privilege to be here with all of you today. Back here, as Dr. Mitchell said, in National Theater for the first time since our commencement in 1870, to share in this moment, this celebration with all of you, our graduates of the School of Medicine's class of 2015, with your families, and with our Georgetown University community here in Washington. A word of gratitude to the many individuals who have been here for you, those fellow students, colleagues, mentors, loved ones who have provided you with the support to help you work toward your aspirations to realize your dreams. Thank you also to Dean Mitchell, to the extraordinary faculty seated behind me, for the deep care and commitment they invest every semester in teaching and scholarship and clinical care, in their contributions to sustaining and strengthening the academic vibrancy of our university community. To our staff for all that they did to make today possible. And finally, to our graduates, to the women and men before me, congratulations on this very special day. This is a very special moment in your lives, a moment of beginning, of looking toward the future, to the challenges that you will encounter, the trials you will endure, the victories you will claim, the unique impact you will have in the practice of medicine. It is my sincere hope that the support of this university, which you will always call home, the friendships you have forged here, the knowledge you have earned here, will provide you with the resources for each of your steps forward. As graduates of our School of Medicine, you came to Georgetown after already achieving very high levels of excellence in both academics and in your early careers. You came after reflecting on your character, your aspirations, your past successes, with the hope of achieving the depth of knowledge required to align the most authentic aspects of yourselves with the path that you envision for yourselves in the future. This is a moment grounded in all of your hard work leading up to today and in the journey of exploration that you've taken during these years here at Georgetown, expanding your minds and your hearts to be able to meet the needs of our world. You've engaged in this work at an extraordinary moment in history. We live in a world whose boundaries are rapidly shrinking, whose opportunities are boundless, but whose challenges are urgent, demanding our most serious attention. This is the 50th year since America launched its great experiment, the Great Society, a set of programs seeking to address some of the deepest problems in our nation: poverty, racial injustice, access to health care. One of the architects of the Great Society, one of the most distinguished public servants of the last half-century, was John Gardner, who served as Secretary of Health, Education, and Welfare during the presidency of Lyndon Johnson. When talking about the challenges of this type of work, the paradox of taking on such formidable tasks, Gardner noted, quote, "What we have before us are some breathtaking opportunities disguised as insoluble problems." Close quote. Breathtaking opportunities disguised as insoluble problems. This reminds us that the hope for our societies is a matter of imagination. It is a hope built upon a persistence to always relentlessly seek answers, find solutions, strive for the betterment of our communities, our nations, our societies. When we take as our starting point that breathtaking opportunities are within our grasp, that seemingly insoluble problems can be surmounted, it changes everything. It brings us a new lens to the questions: how can we better care for one another? How can we build our societies so that they are more inclusive? How can we together better address the challenges that confront us: inequality, injustice, disease around the globe? Looking at all of you, I am confident that you have the skills, the depth of thought, fullness of heart, the imagination to seek the betterment of humankind, to develop the mindset, the talents, the experiences, to be principled and effective leaders in the field of medicine. And now as you graduate, as you commence, as you embark on a new phase in your lives, as you begin your service as physicians, this is a very special time. This is your time. And we could not be more honored to share this moment with you. We could not be more proud to have been a part of your formation. Congratulations to you all on this very special day.
The senior choir will now lead us in our alma mater. I invite alumni to join them. If the words have escaped you, they are printed in the back of the program. Please stand.
I didn't want to say.
Sons of Georgetown, alma mater, swift Potomac's lovely daughter, ever watching by the water, smiles on us today. Now her children gather round her, lo, with garlands they have crowned her, reverent hands and found and wound her with the blue and gray. Wave her colors ever, furl her standard never, but raise it high and proudly cry, we're Georgetown sons forever, and daughters where Potomac's tide is streaming, from her spires and steeples beaming. See the grand old banner gleaming, Georgetown's blue and gray.
Please remain standing. Immediately following the ceremony, there will be a reception for the graduates, their families, and friends on the podium in the backyard of the Georgetown University Medical School. All are invited. Please remain in place until the academic procession is completed. Dr. Mitchell has been asked by the graduating class to give the benediction. Dr. Mitchell.
Let us pray. O Lord, creator of love, breath, and life itself, O holy hidden being, we look at your world in the dark of its night. We're left with the salty tears and emptiness of heartbreak But here they are, Lord. Here they are before you. It is they, Lord. They have heard your people crying in the night. They're prepared, bright, and burning with passion. We stand with their families now and launch them on along the arc of your creation, farther than any of us can see. We know that arc bends toward justice, and they will have significant impact on the trajectory toward mercy and tender care for the whole person. Look down upon these young souls. Teach them to love the world you've made. Give them ears, discerning minds, imagination, and hearts to hear the people of this night. Make them your bright and burning morning stars of hope. Enlighten their hearts to the immeasurable greatness of your power promised to each of us. Blessed are these feet of those who will bring hope and good news to your people. The journey may be long, hard, hot, and tiring. Give them balance, joy, meaningful love of friends and family, and grateful hearts for the journey. These children were born with hearts of gold, but the ways of the world can turn them cold. When they find it hard to care, give them song to sing, make them dare. Take their hopes, dreams, their minds with plans and schemes, the very breath that sang your praise. Give them nothing more than your love and grace. That is sufficient for lives filled with glory and joy. Lord, we thank you for their discerning hearts, courage, and will, and for the gift of their joy and wonder of new discovery. They're the ones who will bring new hope to creation. We celebrate now the cures, hope, and help some of them will bring for the first time ever to your world. Make them burning lights through death's darkness for patients and their own families. Make them a kind and hopeful light for those lost in lives of darkness. Send these lights burning forth. Keep their souls on fire for your work in this world. Help them to fashion lives that are holy and hearts that are true. So go now, young lions, run from this school with your hearts and minds on fire. This world will never be the same. In your holy and wondrous name, amen.